Hello everybody, my name's Sharon. I am a Regional Operations Director for the Central Region. I've worked for Bupa Dental Care for 25 years in June and I have dyslexia. I first found out I was dyslexic about 20 years ago, but I've obviously had it all my life. And it was actually a guy I used to work for and the career that I chose, which was obviously dental nursing at the time. And the way that we look at patients' information, the way that we chart things to do with the patient, we always do it the opposite way around, so left to right. If you're looking at a patient, the patient's left is your right. And the guy that I worked for had worked with me for a few months and talked to me about it. He said, have you ever thought that you might have a little problem with left and right, and maybe you've got a bit of dyslexia? Because he'd looked at some of the notes that I'd written and some of the letters that were the wrong way around, etc. And he was really supportive, to be fair. He had a colleague who was an educational psychologist type sort of person who he brought in to support me. We did some tests, we did some reading, we went over this for a couple of weeks, and at the end of that it was a diagnosis that I had visual dyslexia. It's only to do with written text, it's nothing to do with numbers, and what happens is that written text can sometimes jump around on the page. The letters can appear back to front, or they can appear vertically sometimes. But what I found that really helps me is to make the background yellow. So then that stops that white glare of what's on a background, and it makes it much easier for me to read. There is also some spectacles that you can buy that have a blue or a yellow lens that will also help you. But I think that, there is a lot of stigma attached to things like this, but there shouldn't be any stigma, and you should never be embarrassed or ashamed. There's so much support within Bupa that can help you if you feel that you may have this, or that you know that you've got this. And it will just help you to navigate your way around the workplace. For me, I think that things that have helped me have been visual aids, like I've just explained, the yellow and the blue, and certainly making the font bigger if you've got to present anything or you've got to talk to a large group of people. And actually just not being ashamed and making sure that people are aware of that. It's nothing to be ashamed of. So if you do think that you've got this, or you think that you might, or you definitely have this, then reach out, because there's loads and loads of support about. It certainly shouldn't stand in your way. It hasn't stood in my way whatsoever.